This fluid evaporates, taking heat away from our body and cooling us down. The science behind sweating. Sweating is a complex process that involves multiple physiological systems. It's not just a simple matter of our body producing sweat and then cooling down. There are several key players involved in the process, including the hypothalamus, which acts as the body's thermostat, regulating our core temperature. The sweat glands, which produce the sweat that evaporates to cool us down. The blood vessels, which help to regulate blood flow and temperature. The nervous system, which sends signals to the sweat glands to produce sweat. ##The process of sweating. The process of sweating. When our body temperature rises, the hypothalamus sends a signal to the sweat glands to produce sweat. The sweat glands then release a watery fluid onto the skin's surface. As the sweat evaporates, it takes heat away from our body, cooling us down. The sweat evaporates at a rate of about 1 to 2 milliliters per minute. Sweating varies greatly depending on physical activity, age, and sex. Factors affecting sweat rate. Physical activity. High-intensity exercise can increase sweat rate by up to 50% compared to low-intensity exercise. Endurance activities like distance running or cycling can also lead to increased sweat rates. High-temperature environments can cause the body to sweat more to cool itself down. #Age and sex. Age and sex. Children and adolescents tend to sweat less than adults due to their smaller body size and lower metabolic rates. Understanding hyperhidrosis. Hyperhidrosis is a common condition characterized by excessive sweating, often in specific areas of the body. It can be a source of distress and embarrassment for those affected, impacting daily life and social interactions. Causes of hyperhidrosis. Stress and anxiety. Heat and humidity. Exercise and physical activity. Tobacco use. Certain medications. Hormonal changes. Genetic predisposition. Triggers of hyperhidrosis. Stress and anxiety. Heat and humidity. Exercise and physical activity. Tobacco use. Certain medications. Hormonal changes. Genetic predisposition. While hyperhidrosis can be a symptom of another medical condition, it is not always the case. In many instances, the causes of hyperhidrosis are multifactorial, involving a combination of factors. Diagnosis and treatment. Diagnosing hyperhidrosis can be challenging, as the symptoms can be similar to those of other conditions. The science behind antiperspirants. Antiperspirants work by blocking the sweat glands, preventing the release of sweat. This is achieved through the use of aluminium salts, which are applied to the skin in a gel or cream form. The aluminium salts work by reducing the amount of sweat produced, reducing the amount of moisture in the skin, reducing the pH level of the skin. The risks of antiperspirants. While antiperspirants can be effective in controlling sweat, they also have some risks associated with their use. These include irritation and allergic reactions. Some people may experience irritation or allergic reactions to the aluminium salts used in antiperspirants. Skin conditions. Antiperspirants can exacerbate skin conditions such as eczema, acne, and psoriasis. Dress for comfort. In hot and humid climates to stay cool and dry. The importance of dressing for comfort. When it comes to dressing for a hot and humid climate, comfort is key. Wearing loose-fitting clothes made from breathable fabrics such as cotton is essential for maintaining a comfortable body temperature. This is because cotton allows for airflow and moisture-wicking properties, which help to keep you cool and dry. Loose-fitting clothes reduce friction and allow for better airflow, reducing the risk of overheating. Breathable fabrics like cotton also help to regulate body temperature, keeping you cool in the heat and warm in the cold. If you exercise in the hot sun, try to do it in the early morning or evening when it's cooler. Understanding the causes of excessive sweating. Excessive sweating, also known as hyperhidrosis, is a common condition that affects millions of people worldwide. It is characterized by an excessive production of sweat, often accompanied by a strong body odor. While it can be embarrassing and uncomfortable, hyperhidrosis can also have serious health consequences if left untreated. Physical causes. Genetics. Hyperhidrosis can be inherited from one's parents. Hormonal imbalance. Hormonal changes during puberty, menopause, or pregnancy can lead to excessive sweating. Medical conditions. Certain medical conditions, such as thyroid disorders, diabetes, and anxiety disorders, can cause hyperhidrosis. Medications. Certain medications, such as antidepressants and blood pressure medications, can increase sweat production. Emotional and psychological causes. Emotional and psychological causes anxiety and stress. High levels of anxiety and stress can cause excessive sweating. Low self-esteem. People with low self-esteem may experience excessive sweating due to feelings of embarrassment or shame. Trauma. Traumatic experiences can lead to anxiety and stress, which can cause excessive sweating. Managing excessive sweating *. Managing excessive sweating. Lifestyle changes. Dietary changes. Avoiding spicy foods, caffeine, and alcohol can help reduce sweat production. Exercise. Exercising in cooler environments, such as early morning or evening, can help reduce sweat production. Hydration. Drinking plenty of water can help regulate body temperature and reduce sweat production. The rise of Botox for hyperhidrosis. In recent years, the use of Botox for hyperhidrosis has gained significant attention. Hyperhidrosis, a condition characterized by excessive sweating, affects millions of people worldwide. While traditional treatments like antiperspirants and oral medications have been available, the introduction of Botox injections has provided a new and effective solution for those suffering from this condition. Understanding hyperhidrosis. Hyperhidrosis is a common condition that affects both men and women, with approximately 3.4% of the population experiencing excessive sweating. The condition can be localized to specific areas, such as the underarms, palms, or soles, or it can be generalized, affecting the entire body. In some cases, hyperhidrosis can be a symptom of an underlying medical condition, such as thyroid disorders or diabetes. The role of Botox in hyperhidrosis treatment. Botox, a neurotoxin protein, has been widely used for cosmetic purposes, such as reducing wrinkles and fine lines. However, its effectiveness in treating hyperhidrosis has also been recognized. By injecting Botox into the affected area, the nerve signals that stimulate sweating are temporarily blocked, resulting in reduced sweating. How Botox works. The mechanism of Botox in treating hyperhidrosis involves the following steps. Botox is injected into the affected area, typically the underarms. The Botox protein blocks the release of a chemical messenger called acetylcholine, which stimulates sweating. The blocked acetylcholine signals reduce the amount of sweat produced, resulting in reduced sweating. The device is typically small and portable, making it easy to use at home or in public. The science behind iontophoresis. Iontophoresis is based on the principle of electroosmosis, which is the movement of water through a semi-permeable membrane due to an applied electric field. When a weak electrical current is passed through water, it creates a pressure gradient that drives the water molecules towards the skin. This pressure gradient helps to push the sweat glands towards the surface of the skin, allowing the sweat to be released. The process involves the following steps. Plus, the device is filled with water and the electrical current is applied. Plus, the electrical current creates a pressure gradient that drives the water molecules towards the skin. Plus, the water molecules push the sweat glands towards the surface of the skin, allowing the sweat to be released. The science behind microwave therapy. Microwave therapy, also known as microwave ablation, is a minimally invasive procedure that uses microwave energy to destroy abnormal or damaged cells. In the context of sweat gland destruction, microwave therapy is used to target and eliminate hyperactive sweat glands that cause excessive sweating. How it works. The process begins with the insertion of a thin, hollow needle into the affected area. This needle is connected to a microwave generator, which produces microwave energy.